All right, well, I'm Amy Nicole, and I just wanted to welcome all of you to my journey as I have gone through melanoma 4 times since 2016 all the way up until 2023. And currently, I am actually waiting to get 4 biopsies done that I just had at my skin check. That's the melanoma journey. And then with my cervical cancer was in 2022, and I dealt with that and everything, and I just want to help anyone that I truly can and not feel like they're alone in this journey. So with having like the connective tissue disease, I was told that due to my connective tissue disease, I am not a candidate to get pregnant. Like, they did not want me to ever get pregnant because I, for one, carry the mutation for this connective tissue disease, meaning I will pass it on to any child I would be able to, have. And so I'm like, I wouldn't want that on anyone to have this connective tissue disease. It's not fun. It's really hard. And so I'm like, no, I don't want to risk that. And then the other thing that really pushed my husband and I to get my tubes tied at 23 years old was that if I were to get pregnant, I had a 50% chance of not surviving the pregnancy because of complications with my connective tissue disease, and the hormones would actually make my heart have like the aorta would rupture. And so I found a high risk OBG. She did go in and tie my tubes, and she was amazing. I then switched to all my doctors here in Las Vegas. And due to my family history, my mom had cervical cancer at 35. And so they were always having me do a PAP every single year. And the year after that, I got melanoma. So in 2017, I did test positive for the HPV. And I was like starting to get stressed. I'm like, oh my gosh, why am I testing positive? They're like, it's okay. It's pretty normal. A lot of people test positive, but within 6 months, usually your body just gets rid of it naturally. I'm like, okay. So my OBG, I ended up getting a new one after that. She was like, oh, it's fine. 6 months. I'm like, okay, do we do another PAP? No, we'll do it in a year. So then a year goes by, it was gone. So I'm like, okay, this is good. So then the new regulations were you can get PAPs every 3 years now, or even 5 in some states. And I was like, no, I can't wait. My mom had cervical cancer with my melanoma, my connective tissue disease. There's just too many factors. I just don't trust the process of just waiting. And yeah, cervical cancer is very slow, unlike melanoma, but I don't want that risk. So I got a new OBG who is more specializing in people that have the history and stuff. She's amazing. So I started testing positive again, and it was about 2019. I started testing positive. So 1 year I had no HPV at all. It was 2018, I had nothing. So then in 2019, I got tested again, but with my new OBG, who's really good, and tested positive. So she was like, okay, but it was really like mild, the cells that were showing up. So she's like, we can wait a year. So we wait a year. And then, in 2020, tested positive. The cells changed a little bit. She's like, okay, we're going to test again in a year. And so it got to the point in 2022, when we tested in the beginning of 2022, that it was right before we traveled, that the cells did change a lot more than any of the other years. So she's like, okay, when you get back, we need to test again in 6 months instead of 1 year, because I don't like how these cells have changed. And that's when I got back, I tested at the 6 month mark in 2022, that she's like, okay, it's stage 1. So she's like, we are going to put you in the books for a hysterectomy. And I was 35 years old, same age as my mother. And so she's like, okay, we're scheduling you November 11th, 2022. And so it was a Thursday. And due to my connective tissue disease, usually like a hysterectomy, you get to go home the same day, maybe stay the night. I had to stay 3 nights because of the anesthesia and stuff, to make sure that my lungs didn't get pneumothorax again. Like any time I've had in the past, I usually do get that. So I was hoping, because it wasn't the chest area that was being operated on, it was the abdomen, that I wouldn't have any issues with my lungs, and I didn't. So I'm like, whew, I'm like, I dodged a bullet there. So they did the hysterectomy, and my husband and I decided that if my ovaries looked clean when she went in, that we would leave them so I don't go into menopause. Even though I am high risk for ovarian cancer, I wanted to not go into menopause and just do yearly tests. And my doctor, she agreed that if they looked good, she won't touch them. When something looks good, you don't touch it. And so that's what we did. I'm like, please just leave them. I don't want to go through menopause at 35. So we did do a partial hysterectomy, not the full. And I was okay with that, but that's everyone's like decision, like if you feel it's going to be best for you or not. Ideally, I should have had a full because of the history of the risk of having ovarian cancer with the mutations, but because they looked clean and good, we just left them. And we're just going to be doing the regular testing each year to check on the ovaries to make sure that I don't get ovarian cancer. So she did the surgery. I stayed at the hospital for 3 nights. I did not eat after the surgery those 3 nights. For them to let me go home, I had to eat something. All I was doing was having their ice chips and water. I didn't want anything else. So my husband was like, this is a little weird because usually you have an appetite. And like usually I would have like a craving for like pizza or like a smoothie or something is like the typical thing that I have. I didn't. So he brought me home. And the good thing is the hospital's not far. It's like 8 minutes away. Brought me home. Next day, I looked really fatigued. I could barely stay awake. And he started noticing my cheeks were really red. So he touched my cheeks and he's like, you're running a fever. So he checked my fever. It was like 103. So he called my OBG. She's like, well, her body reacts differently. And I'm not too concerned that she has a fever because of the surgery. Just watch it. Give her Tylenol and ibuprofen, alternate back and forth. By Wednesday, if she still has a fever, bring her in to see us. He's like, okay. So that was a Monday. And so by Wednesday, I could barely eat, could barely drink. And then I started having number 2 issues where I was going every 20 minutes. And so my husband was like, okay, this is getting pretty bad. And like I was looking really, really yellow and pale. So he was like, this is not good. He drops me off because he had to take our little girl, Roxy, to her vet and everything. So he takes her, and I'm at the hospital at the actual like ER. They admit me and everything. But before they admitted me, they did a CT scan. They come back and they were like, oh, we're going to admit you. I'm like, for what? They're like, oh, you have an infection. I'm like, where? In your colon. Like the beginning in your colon is actually starting at like a little infection there. And so I ended up staying at that hospital for about 8 days. And on day 7, my husband noticed that at first, like for the first 3 days of the antibiotics that they had me on, I started to get my color back and I was smiling. You know, doctors, they can do so much, and hospitals too. Like, you have to really like listen to your body and be on top of it. For me, I don't feel comfortable with the male OBG. I feel more comfortable with a female. And it's all up to, you, like who you're comfortable with, but you need to feel comfortable with that doctor because it's a very intimate type of situation where they're going in your private space where you feel like you don't want to feel uncomfortable with them having to do what they need to do. You need to feel okay with it. You need to be on the same page with them and just feel safe with their judgment, and also someone that will not push you to wait 3 years to 5 years, even though that's what the new standard is, especially if you have a history, is my advice. The scans and stuff, since they did the hysterectomy, I don't, but I have to now be watched for ovarian cancer since I left my ovaries. So I did just have my ultrasound done like a month ago. My ovaries look really, really good. I also had to get my hormones checked since I'm off of birth control since I had the hysterectomy. I'm not on any meds anymore. And so at first I did have a lot of hair loss after I had that surgery. There was a lot of trauma, mostly probably from the infection that I ended up getting, which had nothing to do with, the actual surgery itself. But because I stopped birth control, and I had been on birth control since age 12 and stopped birth control at 35, all those years that I was on it, and just the hormones being like, wait a second, something really happened down here. Like, what's going on? I was losing my hair in chunks, like by the handfuls. Every time I brushed my hair, I was afraid to brush it because I'm like, how much hair is going to come out? So I did have to take some extra supplements from a hair company that I truly trust and have been there for me since 2019. And I started taking some extra supplements from them, which actually helps within 3 months of all of that. And I stopped having those issues of hair coming out in the handfuls. So if you have a doctor that you may butt heads with or don't agree with what they're saying, don't get defensive with them or question them personally. Do your research and get a second opinion. But don't stop thinking that you're losing your mind or overthinking. Go with your guts. If you feel something is off, listen to your inner guts and go with it.